I'm truly humbled to be this year's Lung Force Walk honoree, and I really can't tell you how much this means to me and my family, some of whom are on the Zoom today. What I've learned over the years from listening to and caring for people with lung disease and trying to prevent lung disease has been a driving force in helping me to decide which field to study and which field to practice. And it's also been a force in my focus on person-centeredness in healthcare and research. Because the decisions that are made in healthcare about us should be with us, not without us. That is, whether we're one-on-one with our physicians in their offices or in the policy and research space. People with lung disease, and I'm not only talking about people who have the diagnosis of lung disease, but as you've seen here today, people have this illness who have the diagnosis, but also their care partners, their family members, and other members of their community. These are experts in what it's like to live with that disease and how it affects their lives, your lives. Patients aren't and shouldn't be passive recipients of care and policies, but instead patients need to be embraced as partners so that their voices can be heard and their experiences represented. When you go to the office or nowadays to telehealth visits, we can all be sure to bring with us and express what's most important to us and what we know about our health, to share that with our healthcare professionals and with our teams so that they can work with us and integrate that science that you've heard today is advancing so rapidly with what we need and what we want. I urge you to look at the trusted resources that are available to you from communities, and I will say in particular, the American Lung Association. It is a breath of fresh air, as we say. If you look there, you're going to find information and resources on health, lung diseases, and wellness, but you'll also see ways for you to advocate for yourself and for your community. You'll see ways to participate in the research that is so important so that you can contribute in that way, in some way that may help you or other members of the pulmonary community. Living with lung disease at any time, but in particular now, can be daunting, I know. Know that you're not alone. With the American Lung Association by your side, with your families, with your care partners, you're members of a very powerful and connected community. Together today, we walk, we support each other, and we work toward healing. I accept this honor not only as an honor, but as a responsibility to all of you to remain committed to improving the lives of all people seeking lung health and wellness. And again, thank you so much from the bottom of my heart.